Yes. And we're presenting the cancer breathalyzers.
Alright, so each year there are about 7 million people dying of cancer. And leading causes of cancer deaths are lung, breast, prostate, and colorectal cancers in developed and developing countries. And the burden of the cancer continues to increase because of aging and world population as they're growing. And they also adopt cancer-causing behaviors, such as smoking, and they don't exercise as much physical inactivity in the westernized diets. And these are the data that says the male and female cancer rates and also the cancer deaths per year in developing and developed countries as well as worldwide. And the gold standard is the current methods of detecting cancers are these various tests that are used. And gas chromatography and mass spectrometry is what we're focusing on, since our data is compared with test results that come up with that.
Okay, so the bioinstrument is the breathalyzer is a machine, a nanosensor that can detect low levels of compounds in your breath that are that your body produces when there's cancer present. And the type of cancers that it can detect are lung, breast, prostate, and colorectal. So how it works is they isolate gold nanoparticles from a suspended solution, and so these gold nanoparticles are then are capped with a monolayer of organic compounds. This is a picture right here of gold nanoparticles with latex beads on them, coated on them. And so these nanoparticles are then dropped onto an electric sensor, onto an electrode. These are chemical resistive electrodes. And so because they're so small, they're not able to like weld or put them on the sensor. So they use a process called drop casting, where they add a very small bead of liquid on there with containing the solute, and they spin it really fast, and it dries off, and it goes into these little wells of the sensor. And so these sensors right here are then added onto a silicone wafer using a process called electron beam evaporation. So what it does is there's an electron beam gun that's focused onto a little well of these electrodes, and then it heats it, and it's able to control the evaporation rate and where you want it to go onto the circuit. And so there's 10 of these pairs that are deposited onto a silicone wafer, and then so you take 14 of these sensors, and then you place them onto a circuit board, and it forms a nanosensor array. And then here's a picture of the completed array. So then the sensor is placed inside a steel chamber, which is connected to a USB-controlled multifunctional switch. This keeps the breath, keeps all the breath away from other contaminants from the normal air. And so what happens is they take a sample of the patient's breath, and then they put it into this machine. As the breath passes past the electrochemical sensor, it changes the resistance across the sensor because there's a current passing through here. And so this is then read through a multifunction switch. It analyzes the resistance, and the resistance is all based on the person's breath contains the chemicals, and it reacts with the chemicals that are on the nanoparticles.
So the main application for cancer breathalyzer is for cancer diagnosis. It also detects a variety of cancers like lung, breast, colon, prostate cancer. It's important in this field because of its ability to detect cancer in the early stages more conveniently than other methods, which can either be time-consuming or they only detect one type of cancer. Also, there's no physical risk with the cancer breathalyzer. It's non-invasive, and also there's no exposure to radiative imaging. The future is very bright for the cancer breathalyzer. As you can see, these graphs are the results, and it shows a PCA plot of the GMP or the sensor's resistive response to the volatile organic compounds. And these results are very accurate, and they show an ambiguous identification of the cancer site, meaning that there's a very good separation of the healthy patients compared to the patients with the cancer, and they're like formed in clusters. Also, it can end up, if they're trying to make it very fast, easy to carry out for the future, and also try to make it so you don't have to have trained operators. And also they're trying to make it cost effective, more portable compared to other cancer detection instruments. Some improvements that need to be made. Needs to be able to distinguish whether the type of cancer is in the primary state or it's in metastasis. Also, there needs to be an increase in the sensitivity of the VOC identifiers, and these identifiers are used to pretty much sense the specific concentrations of the specific VOCs that come with each type of cancer. And basically, it's imperfect, and they need to improve it by
differentiating different chemicals.
yeah, pretty much.
Any questions?
We have 30 seconds for questions, and then next group, start putting your PowerPoint in. Questions for this group?
Can you make the device small?
Yeah, it's I
Wilson,
mean, it was ready to develop like 2 years ago, so it's still developing.
So that's probably something that's going to be in the near future.
Yeah.
Wilson.
Right.